It is eerily quiet in the town of cancelled.China. The school in this northern Italian town is closed. The bakery will only let people in 4 at a time. Residents outside this pharmacy have to wait. This is in the heart of the Italian outbreak of COVID-19 in the Lombardy and Veneto region. As yet, they don't know where the original case came from, and they don't know why Italy's numbers are so much higher than the rest of Europe. The Prime Minister himself has acknowledged a degree of confusion in the handling of this.
We don't have regional frontiers, so it is clear that in a coordinated handling of the situation, we must have measures that are more effective and presented in a rational way. Otherwise, it becomes confusing, because in different regions, but with similar conditions, they receive different instructions.
What experts do believe is that Italy is likely to have more cases than have as yet been identified. So today, UK travellers were told to self-isolate for 14 days, even if they don't have symptoms, if they have been to the lockdown areas of Italy, and also the most affected cities in South Korea, all of Hubei province at the epicentre of the epidemic, and if they've travelled anywhere in Iran. And if you've been to northern Italy and developed symptoms, self-isolate and call 111. Yesterday, Austria was looking at closing its borders. France was advising people to take their temperatures twice a day and to use masks if they went out. Why are we only doing this today?
Well, you've got to follow the advice, and all the way through this, we're balancing the need to make sure that people take the right action to stop the spread of the virus, with the need to make sure that those actions are proportionate so you don't cause more harm, for instance, with the impact of decisions that you take. So one example is on flights from China. I've had people in the past few weeks saying to me, why don't we just stop all the flights from China? The Italians did that, and now they have the largest outbreak in Europe.
36 countries outside China have now reported outbreaks.
We cannot go out either front or back. There are police cars stationed at all entrances.
These holidaymakers are in quarantine in Tenerife after a guest fell ill with the virus. In up to 80% of cases, the symptoms are mild, so people may not even know they have COVID-19, making it all the harder to trace and all the easier to spread. But he has it. Iran's deputy health minister mopping his sweating brow at a press conference yesterday. A conference called to deny a cover-up of COVID-19 cases. And this is him today.
I'd like to inform you that I have been infected with coronavirus. I had a fever yesterday. My first test was positive last night, and I have isolated myself.
President Hassan Rouhani, on the other hand, says that enemies of Iran are conspiring to shut down the country through fear-mongering about the virus. Yet there are genuine concerns amongst world experts that the true scale of the outbreak in Iran has not been identified, making it all the easier to spread to neighbouring countries, especially those with wars and weak health systems.
Victoria MacDonald, and one of those travellers who's returned from Iran and is now in self-isolation is our very own John Snow. He, along with the cameraman and producer who travelled with him, are following government guidance for those who've recently returned from coronavirus hotspots and will be staying at home for the next 2 weeks. I spoke to him just before we came on air.
OK, I'm in self-isolation as a result of having been to Iran for the past 4 or 5 days, and I'm therefore not really supposed to congregate with any crowds or go anywhere where there may be, people. So that means I'm sitting at home.
For 2 weeks?
For 2 weeks.
And how do you feel?
Well, actually, I woke up this morning feeling rather tired, but that was from the trip. But we weren't actually anywhere near where the main virus outbreak has occurred.
You look fine, you say you feel fine, you don't have a temperature, and yet here you are in your flat in North London in self-isolation for 2 weeks. It must feel rather odd, and I wonder whether you feel worried at all about what might be happening.
Well, to be absolutely honest, the enormity of the prospect of 14 days hasn't really hit me. I mean, I've been doing things to catch up with things that I needed to catch up on, having been in Iran and all the rest of it. And I haven't really had time to work out how, in fact, I'm going to handle this. I must admit that I'm not very good with my own company. I'm a very gregarious character. That's why I like working at Channel 4 News, which is a big, happy, well, mostly happy team. And, therefore it will be very, very strange. And maybe if you call me again in 14 days, you'll find a head case on your hands.
You'll be missing us, John, even if it's only mostly happy. Thank you very much and stay well.
Thanks.
Joining us now is Dr. Rosalind Ego, the infectious disease modeller at the London School of Hygiene and Tropical Medicine. Thanks very much for coming on the programme again. Italy, 10 deaths in a fairly small number of days after only having reported an outbreak of cases, at the weekend. I mean, how worrying are those numbers in a place like Italy?
Well, now that the cases have been found, the authorities there are going to be doing their very best to try and track down the contacts of cases and try and end the chains of transmission that have been happening there in order to get control of the epidemic. Right.
So they've contained these towns that are affected. We've also noticed in China that containment seems to be working because the number of infections are going down. Is that fair to say?
It's difficult to ascribe, cause to effect, but there have been, as you said, very strong interventions in China for over a month now, and that it does appear that the number of cases have been falling. And so that's good evidence that it is possible to decrease transmission of this virus. And what that's really done is bought the rest of us a bit more time to prepare.
You're a modeler, so you're looking at projections into the future.
Yeah.
What are those numbers? I mean, from the evidence so far and how this thing spreads, tell us about the numbers that we can expect on this island.
It's really very difficult to say at this point, and it's too early. The important thing for the UK is to understand where the cases are happening so far, to understand what risk they're at, and to remember that so far in the UK, the cases that we've seen have been brought in from other places. It's people who've travelled. And there hasn't been ongoing transmission from each of those people. And the public health authorities in the UK are doing their very best to keep that true for as long as possible.
So the fact that the numbers of cases has not gone up here since last week, does that mean that we're doing the right thing? Or we just don't know what else is out there?
It's very difficult to say what the right thing and the wrong thing is. People in the UK, our public health agencies are doing their very best to prevent onward transmission from any cases that do arrive.
When I speak to scientists like this, what they constantly tell me is that what really worries them about this virus is what they don't know. What don't we know?
Yeah, there's quite a few things we don't know about the virus, and some of the times from when somebody gets infected to when they start being infectious, that's really important to know. Because it impacts how easy it is to control. What we really need to get a handle on at the moment is what we call the pyramid of severity. Okay, so this is if you have a pyramid and at the bottom you have cases that have very few symptoms, you have mild cases, severe symptoms, and at the very top you have deaths. But right now we don't have a handle on how wide that is.
Right.
And that will give us a much better understanding of the projected impacts into the future.
And can we now say with certainty that it is possible to pass this disease on if you're not showing any symptoms or haven't even tested positive for it? Because there seem to be quite a few cases like that.
There's some indications that there's some early indications that you can transmit around the time that you begin showing symptoms. But this is very preliminary data, and as you say, we need more information to understand that better.
And very briefly, children don't seem to be affected by it. Is that true?
It's really difficult to say whether, exactly the role of children, and so that's something that needs further study.
Rosalind Ego, thank you very much indeed for coming in.